Black women are more likely to die in their birth experience than white women. So what is a Black woman's life worth? Is it worth the $2,500 of preventative care? Like, that is the question. That's the question on the table.
Hello and welcome to the podcast, to another episode of Queerly Overthinking. I'm your host, Adam Harper, and today I am thrilled to be joined by my dear friend and producer, Cass Cooper. In today's episode, we're going to be digging a little bit deeper, not only in our relationship as we kind of open the door, pull the curtain back a little bit, and you kind of see how we communicate on a day-to-day basis, but we're going to be discussing the topic of our own health and well-being and the intricacies of navigating that within the American healthcare system. It's a lot to unpack in this episode, so with that, let's get started. Well, Cass, I'm really excited for this episode because we're kind of going off script a little bit because normally I'm very well structured and well, outlined and organized and everything. And we do have an outline of like general things that we want to talk about, but it's probably one of the more looser written outlines that we've had because I really just want this to be a conversation between the two of us. Yeah, how are you feeling?
I feel really great. Thank you for having me back on the pod. It's been a little while. Lots has happened and changed, and I'm really glad to continue to be behind the scenes, but it's cool to come back on the mic and spend some time with our avid listeners. Howdy, y'all. But yeah, thank you for all that you're doing and for creating space for all these amazing conversations. And I'm good with having a little bit of a casual conversation, especially because you and I talk legitimately every day. So I think that sometimes we do a disservice by not recording our conversations because there'd be some gems in there, man, so it's good to just kind of, chop it up, key, if you will.
Definitely. Oh, I completely agree with you. Sometimes it's funny when we don't go either have like a FaceTime, like if we miss a FaceTime during the day, like if we never talk to each other during the day, it's like, oh, hope we're all good. Like, let me just like make sure like, hey, I'm good. I'm just tired. Or I'm just doing my own thing.
Give me signs of life. I just, do I need, meanwhile, I'm checking your location. You're checking mine of like, oh, okay, well, they're fine. They're at Starbucks. It's okay. Oh, it's Tuesday, boba tea for sure.
Oh, that's true. We've got movement.
We've got movement. Oh, they're on the highway. It's okay. Blue dot moving away, moving in the right direction.
I will say, I think it's really sweet. I will go on record saying this, that I think you were on a work trip and I had told you previously that I was going to be somewhere south of Dallas taking a test for work. And you already know where I'm going with this.
I
do. My phone had to be completely off. Like I had to be completely everything out of my pockets. It was basically going through TSA security to get this test done. And so phone was off, watch was off, but the last known location that my phone put out was at this like testing center. And
no, but the testing center was by the airport. That's what panicked me. Because I was like, he's been abducted. He's being human trafficked from Dallas Love Field.
Oh my gosh.
Like, what is he doing at the airport? I'm like checking your Flighty app. I'm trying to like.
You sent me an email.
I know, because I had called you twice and I had sent you a text message, and then I got on a plane, and then when I landed, you hadn't responded to the text message and you hadn't called me back. So I'm like, oh, hell no. So I sent you an email.
And that's when I knew the minute that like I got out of the test and everything, and I turn on my phone and I see like not only text and then an email come through, like, oh,
text, email, video message, like missed FaceTime. Like, you're dead at this point. Your phone hasn't moved. You are dead, and I need to activate like all the things. Like, I'm like,
oh shit. I just dropped my chapstick. Oh my god.
I was serious too. I was dead ass. I was like, not on my watch. They're not gonna blame me.
I freaking adore that though, because I appreciate that there are people in my life who are actively aware of just my well-being. And
yeah. Listen, I'm just trying to not be on Dateline Okay, I just don't
Literally,
I
second.
don't wanna be on How to Catch a Killer. I don't wanna be the extra on the podcast. I don't wanna be, like, on the true crimes documentary of Adam Harper's life. That's a no for me. So, this episode is really about healthcare and our experiences with them and the unique vantage point that we come from. Adam and I have had a lot of conversations about our health, being millennials of a certain age, me being a geriatric millennial. Adam's a little younger than me.
I'm a zillennial, a zillennial. I
Zillennial,
identify as on the
heavy on the
cusp.
Z,
Yeah.
heavy on the Z.
It's a brat summer
Uh,
girl, you know.
ow. Um, and I think it's really important, especially because so many people either one take for granted the fact that they do have healthcare and access. So understanding the power and privilege that comes along with that, but then also understanding some of the nuance behind why people don't have healthcare and how people, as we get older, it's so important to lean into being healthy, but that is a privilege that not a lot of people get because they don't have access to even the education around what it means to be healthy. And so this while this isn't a conversation about like diet culture and all these things, it is something that we both come with an intersectional lens, being male and gay on one end, being a woman and a mother and black on another end. So it gives us an opportunity to have a very unique and robust conversation. So I'm looking forward to sharing insights and hopefully answering a few questions for folks.
I kind of want to just start this off with, I guess, the overarching question for this first part. And as many folks who have listened to the episodes most recently, I tend to break things out into two parts, depending on how long they are. I try to keep things to a good length. So I know Cass and I, we could talk about anything under the sun for however long, but I want to make sure that we have
And do,
and do.
and do.
The overarching question I think we have for ourselves is, how did you initially get into the healthcare system, like from like a knowledge base and like inner workings and just everything with that specifically, and like what are some challenges that we faced within that, and just like our general experiences overall with that. Cass, I'm gonna turn it over to you. Like, is there anything that
Yeah.
you want to share off the bat?
Sure. So I really think this is a great place to start because I think of my healthcare experience and my experience specifically with health insurance in maybe three parts. So first part being as an adolescent with who was diagnosed with a chronic illness at 14. The second part being an adult who moves from being covered under my parents' insurance to finding and seeking out my own and the medical debt that comes along with having a chronic illness. And then the third part being a mother and even just prenatal care and paying for and navigating the healthcare system around that, along with navigating it with my kid. So like there's three parts to me, so I can start wherever. I guess I'll just start at the beginning. So I was diagnosed with Crohn's disease when I was 14. So I was at the beginning of my freshman year of high school. And my parents, I come from a very middle class socioeconomic standpoint. Both my parents college educated, worked blue or white collar jobs. We had health insurance, but it was very clear to me that there is a increased cost for my medication and for my treatment, and that did put a stress and a strain on my family. So I was very aware of that from very early. I was diagnosed with Crohn's and there was a lot of tests that went up to that. But then what really my diagnosis came from was when I was in the hospital, and actually the weekend before freshman year of high school, I was in the hospital. Can you believe that? That summer was wild, man. So I got off my braces, which was dope. Then I'm like, I don't feel good. And I had like a series of tests. And then I was put in the hospital because my iron levels were low. And I think that was also the summer that I was like playing sports. I was 5'7" tall and 95 pounds. So you can imagine like there was an idea that maybe I had an eating disorder, but really I had this illness that was just starting to show up, and I was in high flare and high intense attack from my immune system. So But it was very clear that that created a stress not just on my parents, right, financially, but it created a stress on my brother and sister as well. And it was very clear that I was in the hospital in and out all through high school, and that came with an extra cost. And I knew it was less because we had insurance, but I also remember not being able to get the designer medicines that were available because and the different understanding the difference between generic and non-generic medicines and things like that. And so I never went without, but it was definitely something that I became heightened aware. And I would say most teenagers, it's not something they think about. And then fast forward to going to school, I went to DePaul University. I moved to Chicago because there was a specialist, a gastroenterologist, who was doing a lot of great work around Crohn's and people my age, so younger diagnosed folks at the University of Chicago hospitals. And so that was a huge reason why I went there. And they had a program that allowed me to maintain insurance coverage to cover these then experimental drugs or new to the market medications. And so that shaded and impacted why and where I went to college. In college, I also had an opportunity to go on a trip that was for basically, it was like studying oceanography, which I had no interest in being like an oceanographer. Like, that wasn't something that I was like, oh, yeah, I want to learn about, dolphins and sea turtles. But I mean, what kid doesn't want to go to Costa Rica for a summer? But I ended up not being able to go because they weren't going to be able to have the medications that I was on, and my insurance wouldn't cover it out of country, right? So that impacted the choices that I made. When I graduated from college, I was actually $500,000 in medical debt. $500,000, $500,000, a little under. And because I was in the program at the University of Chicago at the time, I was able to get that written off and I did not have to pay it because they had a grant and a loan. But I essentially started my 20s with an excruciatingly amount of debt. And I remember just being so weighted down by that. What am I going to do? That's more money than, my little $30,000 fresh out of college job was going to pay, right? This was a long time ago. Now people get out of college making a lot more money than that. But, and so it weighed on me, right? But then and still, I knew that I had to have health insurance. There was no way that the medicine that I was on could be sustained long term just out of pocket cost. And that's really where I started to do more research about, okay, why is insurance important? What is a medical deductible? What is co-insurance? What's a copay? How do I make sure that I have those things? What can I do if I don't have them? And it's always been a part of my life. There's never been a time that I can remember that I didn't understand or need to know where my medicine was going to come next and how much it was going to cost and what coverage. I've always been available and able to fight insurance companies, like, and call and say and cut through the red tape and all these things. Fast forward to when I had my daughter, it wasn't fair. And I was very adamant about, okay, this is what is covered. This is what is not covered as far as birth and prenatal care. These are the things under my health insurance that are covered. These are the things under my health insurance that aren't covered. This is how much I would like to pay. Let me go ahead and start negotiating that. And I think I would not have known those things had I not been able to negotiate all of that stuff previously. I will also say a big reason why I got married, which I'm now divorced, is because my now ex-husband offered me a health insurance and I didn't have it at the time and there was no Obamacare. So it wasn't like mandatory. And so he basically put me on his insurance as a domestic partner, and he was only able to do that because the company he worked for was based in California, and California at the time had domestic partnership clause for health insurance and healthcare. I mean, it has been a pivotal part of my 20s, 30s, and now in my 40s. It is the first question I ask if I go into a job interview. I'm like, okay, great. Yeah, salary, blah, blah, blah. What's your copay? What's your co-insurance? What's your deductible? High, medium, low. I need to know, do you, and then I'll go and I'll say, okay, well, who's your insurance carrier? Okay, it's United Healthcare. It weighs into what I'm going to do next, right? Because if my doctor isn't taking that insurance, I've been with the same doctor for 15 years. Like, I gotta take care of myself. So short story short, long story long, it's always been something that I've been aware of.
Everything you said, I think, is just honestly to me really astounding because I was listening intently as you were sharing your experience, especially the amount of money that you had written off. And to me, that's just wild that like that even accumulated, but then also there was an option to have it written off as well. You know, like I'm looking at this from a lens maybe of somebody who's not in the American health system, who like let's say somebody who lives in like that has universal health care or something like that, you know, and just to
Yeah.
hear that like experience, like, you know, I can't fully fathom what they might be thinking listening to everything with that, but you know, even just hearing that myself, I'm like, I don't think you had mentioned that before, so that's, I'm like still processing that a little bit more.
Yeah. Yeah. What we underestimate in the United States is the amount of debt that accumulates from being sick, right? And being ill. And for someone like me who has chronic illness, what's my options? Right? Is
Hmm.
there an option to not take my medicine? No. Like that, I wouldn't be able to live my life. I wouldn't be able to function. Are there other medications that may I use that underline underscore italics bold may have the same impact as the medications that are more expensive. I mean, that's a possibility, but is it worth risking my health in order to find out? And why is it so expensive? Why, like, if you think about it like this, all of us are one diagnosis away from bankruptcy. Truly. Like, that's a crazy, crazy thing to think about of and then not think of it in terms of like a crisis, right? And to think that, oh well, you just need to get a job that has healthcare. Well, why is it set up that my job is connected to my healthcare? And what if I didn't go to college? What if I was a service worker? You know, I waited tables for a long, long time and I didn't have health insurance for a long time or I paid out of pocket. That is a big, huge cost. So many people just either one, don't have health insurance and then flood emergency rooms, or have health insurance and take it for granted that this is something that is just always going to be there. I mean, I've got statistics, so I can throw those at you if you like. Is that okay?
Yeah,
Okay,
yeah, yeah.
cool. So, healthcare spending has grown by 4.1% in 2022. It's comparable to pre-pandemic years. So you think like during the pandemic, people weren't getting as sick because we weren't around each other as much, even though a lot of people like had COVID. We just the cost went down, but now we're seeing a steady increase in the spending around healthcare, right? The breakdown of costs. Majority of categories of healthcare spending include hospital care, physician services, clinical services, prescription drug costs, nursing care facilities, home health care, and other personal health costs. Like what is in the other category? That's literally everything. So your prescription drug costs, your hospital care, physician services, right? Like that's just crazy. And then this is the one that stands out to me also. In 2022, the US spent $4.5 trillion dollars on healthcare, which is about $13,493 per capita. It's 17.3% of the gross domestic product. So a fifth of all of our spending is on healthcare.
Oh my gosh, I did not even realize that, but I totally believe you.
I mean, it's just it's crazy. Like, and if we compare it, because you talked about how other countries have universal health care, of high income countries, we spend more per person than in Australia, Switzerland, which is the closest one at 12.4%. So we spend 5% more of our GDP on healthcare than Switzerland, who is the closest. Australia is 9.6%. Like it's crazy how much they can get more healthcare for less money. How does that make sense? Like it just to me it does not make sense. I am baffled by it every single time. I accept it as fact. It just is a part of my life like I said, but it's just it's wacky. It's not right.
I'm not gonna like necessarily go on record to say this, but like I will say that I've heard that governments that have universal healthcare, I believe, do tax more potentially. So, but I'm not sure. Like, I need to go double check that fact or that hypothesis or whatever.
Well,
But
I
like,
mean, but I also think like it's tax more is sure, right? Like I think that that's part of it, but also I would rather pay a fixed tax and know what that's going to be out of my annual income than having to guesstimate how much my healthcare is going to be for the year. Like,
mm,
heaven forbid you have an accident, right? And it might not even be a serious accident. You might just trip and fall, stub your toe against a table, and fracture your toe,
mm-hmm,
right? But that is going to cost you because you got to go to the emergency room. You got to have follow up. What is your deductible? Like, all these are all things like you're basically hedging your bets over the next year of every time you have open enrollment. Like, that to
yeah,
me is like, what? Like, do I think I'm gonna need healthcare? And to me, when we were talking about like the cost of just being alive is, because especially as we get older, like, honey, I'm pretty sure I'm perimenopausal. Like, that's a whole nother set of costs that it's like you don't even think about until you're in it. Hormone replacement therapy. And then we're in a place, and now I'm going off a tangent because we're in election year, so I gotta go down this rabbit hole. Now we're in a place where we might not even be get that because it's considered gender affirming care. Like it's crazy. So
yeah,
anyway,
yeah. No, I totally hear you, girl.
there's also things that don't cost a lot of money that can help us have better healthcare outcomes that insurance companies refuse to pay for because it's not traditional Western medicine. Okay, cool. Well, my birth doula, so I had a natural unmedicated childbirth. We've talked about that on the pod before. And it was the best thing for me. Not every woman wants to do that. That's fine. That's your choice. Your body, your choice. Totally get it. But for me, that was what I wanted to do. And it cost me, but my doula, who helped me in that situation, was not covered by health insurance. But we know that doulas being just in the room help reduce the overall cost of the cost of intervention and reduce the chances of C-section by 2/3.
Oh
So
my
like
god.
just them being in the room is helping reduce the cost of my overall child or birth experience. And so, but then you're not going to cover it. Now, the question is, how much did my birth doula cost me? It's a very good question. $1,400.
Oh wow.
I paid that woman $1,400. Well, maybe it was $2,400 because I also did a birth class. Either way, let's round and say $2,500. Especially when you're thinking about like Black women are more likely to die in their birth experience than white women. So, what is a Black woman's life worth? Is it worth the $2,500 of preventative care? Like that is the question. That's the question on the table. You had talked a couple of times about your experience with the healthcare system and finding insurance for your first time at like I think it was when you got your first job. So tell us about that. Like what's your experience with healthcare system? Mine is long and varied and in depth.
Totally, you're totally right. Yeah, I really didn't understand what health insurance was until my first job, where it was an option for us. So I had grown up and thankfully was on my parents' insurance because my dad, as you also shared, had a white collar job. He's a accountant, so he'd been doing that for several years. And I never really understood, whenever we went to the doctor, what I think I had heard the terminologies thrown out there like copay, deductible, out of pocket, but like I never really understood it. But then when I got my first job out of college that had insurance, I didn't really know what to pick. I didn't understand, the different plan types that my employer at the time was offering. And so I just picked the cheapest one because I was like, I can't afford this higher paid plan, even though it looks great and has other like coverages that I would like and everything. So that was really tricky for me because, as a gay man, I need to take precautions sexually because I'm sexually active and I get tested regularly to prevent any STIs and to treat any if there are any, and to also help prevent HIV. And I remember when I was after I finally, secured my healthcare plan, I knew I needed to find a local STI doctor who could, regularly test me and prescribe me PrEP to help prevent HIV. And I remember going to one specific office and I didn't understand how much the visit was going to cost me walking in. After the visit, I was sent a bill, and I think it was like for $300. But for somebody who had just like gotten their first entry level job, that's a huge. That's like that was probably 3 weeks or 4 weeks worth of groceries potentially of just like, because I'm a single man, I'm not having to buy a lot of groceries, but like, that's like a month's worth at the time for me of food. And I just remember being so shocked that I was going to have to pay this. I called their billing department because I was just like, can you help explain this to me? I really don't know what to expect from this. And the woman who was helping me at the billing department, she was nice and was trying to like help explain a few things. And I didn't understand that it's important to, and we might get into this later down the road about, different things that you should be aware of as you're going through your journey of your health and wellness and such, and like different tactics to use and such to better understand your coverage and why you're being charged certain amounts and like all this other stuff. Like we'll get into that down the road. But I just distinctly remember her coming back to me and saying that the doctor was not going to write off something that I thought was like preventative health care, even though like my plan had it was so tricky when you like try to figure out what is
Yeah.
preventative care versus what's elective care. And
Yeah.
so the doctor came back and like slapped it saying like, I'm not going to write this off as preventative, even because it was like an elective screening, which I was like, I didn't think this was like elective or whatever.
Which, to be a gay man who is sexually responsible, right? It's really not an election, right? That is preventative care. We often think about like politics being separate from our healthcare, and that's not really something that comes into play, especially for men, right? Because like, or the assumption is for men, because it's like, oh well, they're never going to have babies, and so they don't have to worry about abortion laws or anything like that. But like it really does impact what your provider is willing and how they're able to bill you, right? So
Mm-hmm.
like to say that that's not preventative care and that's an elective care, what I hear them saying is, well, you shouldn't be having gay sex
Mm, mm-hmm. Mm-hmm.
because it's an election. It's a optional part of your healthcare. And it's like, no, actually it's not, because we want to make sure that we are advocating for safe sexual health, right? And that we are encouraging our patients to do so. But some doctors may see it that way and other doctors might. And then to think that there's no way for you as the consumer to even say like, no, actually I disagree, or this is a preventative care, or I need this. It's really up to people who are not doctors, who aren't in that room, or even like your doctor, depending, or your doctor's billing department that decides how they're going to bill it, right?
Mm, mm-hmm. Mm-hmm.
Like an insurance company gets to decide what they're going. That's the thing. That's the part that's wild. For those who don't understand, right? So you get your explanation of benefits, and sometimes it tells you what it's supposed to tell you, everything that's broken down in your bill, right? But it's like you go to the doctor. Your doctor sets a price for how much their time is worth and how much their care is worth. They then take that and send it to your insurance company. And the insurance company, because they have pre-negotiated how much they're going to pay your doctor, then tells your doctor how much they're actually going to pay. And depending on your co-insurance deductible, whatever, then you either pay the difference or you pay a little bit of the difference or whatever that looks like. So let's say your doctor says that their time is worth $300 for that visit, but your insurance on the pre-negotiated rate is only $100, and and you haven't met your deductible, so you're on the hook for that $100. But let's say you have a high deductible or a low deductible or high deductible plan, like maybe you're on the hook for $150 depending on what they've pre-negotiated. So you as the consumer don't really always know the transparency. You're just picking a doctor based off of whatever criteria you see as fit and the health care that you want to have. Like it really is like a cyclical crazy system when you think about the way that we even arrive at the bill.
Mm-hmm.
And that's
Mm-hmm.
assuming it's just a regular visit, like let's forget if you actually, like, I don't know, needed a blood test.
I feel like, for me, it was the very vulnerable time to have to understand, like, even though my health insurance was saying certain things were preventative care, that not every doctor's office is going to interpret it that way. And so from there, I really had to, just be more, we'll get into this further, but just more vocal and more active about asking questions up front. But
Yeah.
before we get into that, because that's going to be more so the second part of our conversation, I just want to wrap this first part by talking about how there are bills right now going through, I believe, the state of Texas. I need to go and actually get like the actual bill number and such what's going on. But there's a bill going through that due to religious clauses for an employer to say like because they don't believe or support, the LGBT community, specifically the prevention of HIV within a healthcare insurance plan, that they shouldn't be required to pay for that or make that available. So obviously in the state of Texas, you can shop around and find a judge to rule in the outcome that you're looking for, but it's a little nerve wracking because a lot of recent legislation that has gone national has often started in Texas. I'm concerned about this just because I might not be able to afford my PrEP prescription or my blood work visits because those are not cheap. Like the prescription that I take, even the most generic version of it, which I used to be, as you had mentioned, like, there's fancier, newer prescriptions and medications that come out that, have less side effects and such. I used to be on the higher version of that prescription to prevent HIV. But because there was a change in my health insurance, which again, we'll get into this a little bit later, I am no longer able to use that like more fancy version of the prescription. I have to use the generic version because that's what my insurance now covers. I don't know if that's negotiated based off of my employer because I've heard other people are still able to get that fancier version of the HIV prevention medication, but that's currently what my provider and my health insurance covers and such. So it's frustrating, but even with the generic version of the prescription, it's like $2,000, I think, a bottle. I had to double check, but
Yeah.
it's like in the thousands. So the fact that like I could not afford that
That's
on my
your
own.
that's your uninsured pre-insurance cost.
Hold on, let me look. I actually can pull it up right now. Okay, so I will say now that I'm looking at this EOB here, which EOB means explanation of benefits, if you didn't know already, the generic version of PrEP or Truvada, which is like a really long name that I'm not going to try to pronounce because it's a super long fancy name, is $735. Again, that's the generic
The
version. When I
name
was
brand, yeah, yeah.
taking the fancier version, like there's the actual name brand Truvada, and then above that is Descovy, which is like relatively new and it's, I guess, better for certain organs. I think it's kidney or liver, one of the two. I can't remember which. I was originally taking Truvada. I got upgraded to Descovy based on my doctor's recommendation, but then I had to go
Yeah.
down to the generic version of Truvada. So Descovy, I think that was like the one that was like $2,000 per bottle of like a 30-day amount. But anyway, so now that I'm on the generic version of Truvada, I'm not paying the full amount of this because obviously I have a health insurance coverage, but it's $735 for 3 months worth now. I think they like changed that recently. But then I think I pay
Mm.
$45
Yeah.
every 3 months for that, for like the actual pickup from the prescription. So anyway.
Well, I have a similar situation, right? So I was talking about how I went to school in Chicago so that I could be a part of the group that was some of the first patients to have the drug is called infliximab, but the designer name is Remicade. So I was one of the first people after it got FDA approved to be used for Crohn's. I was one of the first to be on it. So that was 2002, maybe. Yeah, 2001, 2002. It was gangbusters. It changed my life. It made it so I was in remission. I had some adjustments to the drug over time, but I essentially have been on it for 20 years. But when it came out, this is where the extenuating circumstances and the $500,000, when it came out, it was I think it was like $25,000 each treatment. That was before insurance. After insurance, it was maybe closer to 18 or 16 grand. And I have to get it every 8 weeks. So every 8 weeks for 20 years, I have been taking the same medication. Well, since then, the drug companies have evolved. There's new things like Humira came on the market, all these other new drugs that are, they're all biologics and they all do the same thing. They just have different names and all these things, right? So I get a call and they're like, hey, we want to move you. My insurance company would not approve me to be on Remicade because it was too expensive, because again, it's the designer drug. And so they're like, we want to move you to Inflectra. I was like, absolutely not. I've been on this medication for 20 plus years. Had no issues, no problems. There's no reason to change it. I don't want to break what's already fixed. Like, that's crazy. And so I went to my doctor and I said, like, what is the deal? And he was like, okay, it's this. And he gave me confidence. Again, I've been seeing the same GI for almost 15 years now, maybe a little bit less. And he gave me confidence. He was like, it's exactly the same. We'll change it. He's like, and I was like, okay, well, what happens if I can't go back on it? So the reason why I changed to this new drug, Inflectra, which is the same, genetically speaking, in the same chemical compound, is because the insurance company decided for me that it was too expensive. And by too expensive, I mean it's saving them, like, I think now it's like 12 grand pre-insurance cost, but I'm still have to go every 8 weeks, right? And then to add insult to injury, and you might want to look into this actually, is sometimes they have medical reimbursement and prescription drug reimbursement plans where you can get literally money from the drug company to tell you to offset the cost personally. So I'm in one of those. And so my out of pocket cost is a few $100s minus my co-insurance and my copay. Had I not known about that, had I not been on this for a long time, I would not have had success there. Like, there's so many things where it's like, it feels like it should be a decision between me and my doctor, but the reality is that it's a decision between my insurance company and my doctor, and then I just get whatever they decide. And that to me is the problem.
Oh my goodness gracious, y'all. What an episode. What a conversation. Oh, it's a lot. Like, again, as I mentioned earlier in the intro, there's just so many complex things to navigate within your own health and well-being, the healthcare system in America, so much. Obviously so much that we had to break this out into two parts. So with that, stay tuned for part 2, as that'll come in 2 weeks. And be sure to subscribe and hit that notification bell so you get notified when that episode drops. And if you haven't already, follow the podcast on Instagram or TikTok for more updates on when episodes drop or the quote highlights from each episode. Thanks again for listening, y'all. And I hope you have a great rest of your day, and we'll see you in 2 weeks. Queerly Overthinking is hosted, edited, and executive produced by Adam Harper, with additional producing by Cass Cooper. You can follow Queerly Overthinking on Instagram or TikTok at Queerly Overthinking, and you can find more at www.queerlyoverthinking.com.